important one, I think. It's something that I think drives a lot of people into having these procedures, and I think it'd be really good to actually speak to people who can give us some insight into that. And our speakers today are Antonia Mariconda and Dr. Antonis Kousoulis, Professor Nichola Rumsey, Professor Clare Chambers, but they're not all here, and Professor David Veale. So shall we start with those who are on here, who is, I can see Antonia's not here. Antonis Kousoulis, is he on here yet? I thought I saw Antonis's name. No, he's gone. Okay, Nichola, can we start with you then? Can you just give us a brief 2 minutes on, you know, what you think we need to know about this important subject, and then we move on to the next one, and then we come to questions.
Absolutely. Absolutely. Thanks very much for the opportunity to speak. So from my perspective, which is psychology, there are a variety of forces in our social context now, including things like social media, celebrities, influencers, lots of different phone apps, and also the internet, and they're all kind of conspiring together to contribute to growing levels of dissatisfaction and distress about our looks. And for the majority of us now, managing our appearance isn't a source of fun and enjoyment that it used to be, but instead for too many people, it's a cause of worry and rumination and anxiety. And against this backdrop, cosmetic procedures have increasingly become seen as the quick fix for all of this, a kind of shortcut not only to the right look, the look of the day, but also to better self-esteem and social success and even greater happiness. And people's expectations of the likely outcomes of those procedures are all too often unrealistic. The other worrying thing from the psychological point of view is that in recent years, there's evidence has emerged of a high level of a broad range of psychological vulnerabilities in the people who undergo cosmetic procedures when you compare them to the rest of the broader population. So those vulnerabilities are things like body image and eating disorders, mood disorders, so things like anxiety and depression and even suicidal ideation. Think more mundane things like disordered sleep and higher levels of alcohol and drug abuse. But all of those put people at risk, and those vulnerabilities can increase a person's susceptibility to external pressures to change their appearance, so they might be more susceptible to things like messages in social media, but they also increase the likelihood that they'll have unrealistic expectations of what might be the other end of a cosmetic procedure, so the likely aesthetic and psychological outcomes. So cosmetic procedures are very much here to stay. They're part of the landscape now. But there's wide recognition that psychology is a key aspect of aesthetic treatments such as these, yet the vast majority of practitioners in this sector don't have the necessary knowledge and skills to address this very crucial aspect of effective patient or client management and care. And as you well know, there's been lots of inquiries and reports in this sector in the past decade, and all of them have called for urgent measures to safeguard potentially vulnerable clients from these unrealistic expectations. And recommendations have included the very topics that you want to look at today. So things like better training for practitioners and better methods of assessment that can be rolled out across the sector. But unfortunately, so far, all our efforts to develop these have been hampered rather by the lack of data in the sector. So people don't collect before and after data that we need to improve our understanding. And there hasn't been any funding to develop authoritative methods of assessment and authoritative evidence-based training for people in this sector that could be used across the board. But I think the toughest challenge that faces us all at the moment is implementation. So how do we get the progress that we have made on training and the progress we have made on assessment, how do we actually implement that in a very diverse and disparate sector? And in the absence of regulation, we really need a coordinated sector-wide approach and really effective leadership to raise the standards in the sector and safeguard the people who are less likely to benefit from the services out there. So those are my particular angles. I think you're on mute.
That was very good. Thank you very much. I'm going to come to Antonia next. Hi, Antonia.
Hello. Hi, everyone.
If you could just give us 2 minutes on, you know, what you think we need to hear, and then we'll we're going on all the speakers and then we'll ask questions. So Antonia,
Mariconda. Yeah. Okay, thanks. Yeah, my background is health and beauty in journalism, and then I ventured into setting up a campaign, Safety and Beauty. And then because of the amount of complaints we were getting through our campaign, I decided to study and qualify in body image counselling and took a specialist route down that road. It seems to me, it's pretty much what Nichola was saying, that many professionals and experts have made great inroads into putting in pathways for better screening. Unfortunately, what's happening is they're not being implemented. And the reason for this is that many people find that they don't want to spend too much time on mental health and well-being because they think it's going to take away from their livelihoods. And, you know, if they're spending time on that, it might put customers, clients, patients off from doing the treatments. And also there's a degree of, are you saying there's something wrong with me? That a lot of therapists, all the way through to cosmetic surgeons, you know, are finding it tricky to deal with. So the question is, how do we do what we do and do it safely? And what do we need to do to implement a faster, efficient pathway in that is quite universal? Of course, a treatment for, you know, a Botox or a filler treatment is very different from a highly invasive body cosmetic or facial cosmetics procedure. So we need to understand the scales of the severity of the issues that we're dealing with, and maybe have a tier system for screening that's a lot more efficient and quicker. That's my suggestions here. A lot of the complaints that I read at Safety and Beauty where people are unhappy with substandard procedures, I can immediately see that had there been a better degree of screening, I wouldn't be reading the complaint. And like I said to you, there's two problems here, is that some procedures are rushed into on a very ill thought basis by the consumer, because they're pressured by social media, advertising, etc. And then like we have on the other side, the practitioner is fearful of doing too much screening or even going there at all for fear of losing the customer. So we need to have some kind of reassurance and safety net in place, explain properly to both parties that it will ultimately benefit both parties. Had a great conversation with a plastic surgeon a week ago who said to me, Antonia, I'm not going to open up during this lockdown. She had CQC registration, which meant she could provide aesthetic procedures under a medical framework. She said, I'm not doing it because I've noticed that so many more people are complaining now because they've got time to notice that tiny flaw and imperfection that perhaps pre-lockdown they wouldn't have complained about, or they wouldn't have, you know, moaned about or necessarily flagged up. So I said to her, well, what do you want to do? I said, because I can sense you're really nervous and anxious. And she said, I'm not going to treat anyone unless they have some kind of counselling or screening. And I said, well, that's a really, really good decision for you to safeguard yourself right now because you've seen an increase in complaints. And also for the consumer. She said, I've never experienced such a height of such emotional complexity as I'm experiencing now. So many practitioners are noticing that the problem that they're seeing isn't one that's just been created now. It was always there. They're just noticing it a lot more now. Whereas all ethical practitioners and surgeons who are doing their jobs and doing them well, like Nichola, will have flagged these issues up years ago and are trying to make great inroads. So my suggestions are better screening that is efficient on both sides, and a great level of education here. Because when you speak to your average consumer off the street, as soon as you say psychological screening, emotional screening, they immediately think, what, you're trying to say there's something wrong with me then? Are you trying to say I've got an issue? I think if we can start to educate people and say that we're asking you these questions and screening you so that we know we're doing the right job for you, and helping and supporting you, that's why we're putting these tools in place. If we put those tools in place as well for practitioners, surgeons and professionals, we're also safeguarding them, their professions, their reputations and their businesses. But right now, 9 out of 10 professionals I speak to, whether they're beauty therapists or surgeons, have very little screening in place, very little.
Thanks, Antonia. Antonis, can we come to you now before we lose you again? You're on mute. We can't hear you.
Can you hear me now?
Yeah.
Yeah, thank you. Apologies, I seem to have issues with my network, but I've joined on my mobile now, so that I think that should work. Yeah, so I think from a perspective of the Mental Health Foundation, from a public mental health perspective, my focus and expertise is a lot on kind of prevention of mental health problems and issues where there are risks linked to our society and more broadly the structures of our societies and communities. I think for me it's important to understand how we can walk the line between protecting people who are vulnerable and educating people, educating young people as well as parents and others, and at the same time ensure that there is appropriate regulation in place. One of the things we have seen is quite different voices on this issue calling for different things. And I think this often happens when there isn't a lot of evidence on a specific topic. So walking the line using what we call the precautionary principles, so taking the best decision on the balance of the evidence that we have at the moment will be important. So I'll be contributing from kind of a preventative public mental health perspective. Thank you.
Thank you. That's really interesting. I did see Judith was on, but she may have had to go somewhere a minute. Right, I'm going to go. There she is. Judith, my colleague, who's the co-chair of the group, has been able to join us now. I know Judith has been on select committee, so she was slightly late coming on. David Veale, can I come to you now?
Thank you. I'm a trustee of the Body Dysmorphic Disorder Foundation, and I also run a national specialist service at the Maudsley Hospital for people with severe BDD. So BDD consists of a preoccupation with perceived defects or ugliness, in which individuals become very distressed and can interfere a lot in their life, and often have these sort of compulsive type behaviors, like lots of checking in mirrors and taking repeated selfies. And when it becomes very severe, they may become very depressed and very suicidal. And generally the opinion is that people with BDD are either dissatisfied with cosmetic procedures, or if they are satisfied, it doesn't really alter their symptoms of BDD, and they remain very preoccupied and distressed with their overall appearance. So it may be that milder cases are okay, and it's very difficult to do good research in this area. And there's also very little data on how common disorders like BDD are in non-surgical cosmetic settings. It's probably that the fillers and Botox and so on are less of a problem than in surgical cosmetic procedures like rhinoplasty, nose jobs and so on, which seem to have a higher rates of sort of mental disorders and BDD. But it's the similar problems. And as I think you've already heard, there are no requirements for practitioners to do any screening for mental health problems or expectations. I mean, good practitioners will do this if they have concerns and refer them for a full assessment. But, bad practitioners just highlight other areas that could be improved, or try to sell you more procedures and just make you feel worse. So yes, of course, it would be helpful to have screening by questionnaires, interviews, and Nichola and I have been working on these initiatives for several years, mainly in sort of surgical areas, but it's very difficult to get even cosmetic surgeons on board. And, unlike Nichola, I'd agree, we do need much better research in this area. I think my suggestion and view is that we would want to try and get the Care Quality Commission, CQC, on board, and get it mandatory for both the surgical and non-surgical cosmetic procedures to do that sort of screening, because although, as you've heard, there's lots of recommendations and nothing seems to change. But, the CQC does have teeth, and they can actually, say this has to be done, and people will get it done. Just on a side note, it's also interesting to think about what some women are trying to do to try and redefine beauty with excessive lip fillers, or what practitioners sometimes refer to as over-treatment. And, you post all these pictures on Instagram. There is this sort of subculture of excessive lips and other secondary sexual characteristics, which are all out of proportion to the rest of their face or body. We are trying to do some research on this at present, trying to understand their motivation and whether they're more likely to have BDD or some other emotional problems. And it really is very strange way that, you know, this new way of beauty is being defined. So I think that's all I got to say today.
Thank you, David. That was really helpful. Clare Chambers, your moment to shine has come.
Thank you very much. So just to introduce myself, I'm an academic philosopher, but today I'm speaking on behalf of the Nuffield Council on Bioethics, who published a report into the ethics of cosmetic procedures in 2017, and Nichola and I were both part of the working party that produced that report. Now, the Nuffield Council strongly recommends that the invasive non-surgical procedures considered in this really important inquiry that we're really glad that you're undertaking should be provided only by regulated practitioners who have the right qualifications and skills. And ethical practice doesn't just benefit users. That's something really important to remember. It also benefits practitioners. It provides them with the tools they need to ensure that the procedures they're delivering aren't making things worse for their clients. And it helps protect practitioners against the likelihood of unsatisfied users and post-procedure complaints, as Antonia has mentioned. But practitioners need support then from regulatory bodies such as the JCCP or the CQC was just mentioned, to provide them with the ethical codes, training and qualifications they need in order to operate in an ethical way. And I think it's important to remember that when beauticians provide invasive treatments, they cross an ethically significant line. So in other kinds of non-invasive beauty treatments like manicures or facials, it may well be appropriate for practitioners to see themselves simply as offering a service to customers, understood as freely choosing consumers. But when the line is crossed into the provision of invasive treatments, practitioners then acquire additional responsibilities to prioritise the welfare of their users. And their users sort of shift then from customers to something closer to patients. And we can see that because these invasive procedures are typically performed in a kind of trust-based, quasi-medical environment. I mean, partly that's a necessary feature of providing invasive treatment. Additional hygiene and precautionary measures are needed. But that kind of quasi-medical impression is often reinforced, for example, if practitioners wear white coats or use the language of medi-spas, that sort of thing. And that move then to a quasi-medical environment and these quasi-medical practices creates a sense of trust in consumers who feel that the invasiveness of the procedures and the medical aura of the setting means that the procedures must surely be highly regulated and that practitioners must surely have specialist qualifications. I think many people are astonished to hear that isn't the case, that, for example, there are virtually no regulations on dermal fillers, that anyone can administer them, that the injected substances may not be regulated. So in other words, users tend to assume, I think, that the procedures they're considering are regulated and safe since they are invasive and medicalized, but since there is in fact little regulation, users don't have full information, and that really does undermine their consent. And I think that this recognition that providing invasive non-surgical procedures is a sort of distinct trust-based area of practice highlights important responsibilities for the industry as a whole and for individual practitioners. They must accept the need to operate in accordance with ethical codes of practice if they want to enter into this area. And just finally, sort of say one brief word about the context in which these procedures are chosen. So I just want to echo everything that Nichola Rumsey has just described, that we are living in a culture that prioritizes physical appearance, one in which the pressure to look good is overwhelming. And this context creates high levels of appearance-related anxiety, which I think is just not always taken into account by providers when treating users. And that raises serious ethical concerns. So the industry itself must promote its products and procedures in ways that do not contribute to the creation and promotion of damaging appearance ideals or the pressures on individuals to meet these ideals. So that's an ethical responsibility, I think, that the industry and the individual providers share with the media, with regulators, with government and with society as a whole. Thank you.
Thank you. What I didn't say at the start of the meeting is that this whole investigation or inquiry that we're doing is about looking at the role of aesthetics and where we would like to see legislation and regulation going as an all-party parliamentary group, something that both Judith and I are really concerned about. We didn't start off looking at this. We started at looking at the contribution the beauty industry makes to the UK, to the economy, to employment, even you know, things like modern slavery and everything else. But this was something that grew out of that, and it does worry me, and I know it worries Judith, particularly because Judith's got a 16-year-old daughter, and I think I probably see this in every meeting, but it's Judith's 16-year-old daughter that shares with us the stuff that young kids are actually thinking about having done to themselves, purely because they've seen something in a magazine, or because somebody else's niece, nephew, cousin, whatever is having something done. And I go back to the old days of sunbeds and with this obsession with fake tanning, where people would take tablets to be brown, they would fry on sunbeds. And it worries me that we've not, even though we managed to get regulation around under 18s using sunbeds quite a few years ago now, back in 2010, we don't seem to learn any lessons about the pressure that we put on people, and that terrible situation where someone is seeking perfection. There is no such thing as perfection, and until you're at that point where you can accept that what you are is who you are and you seek to be something else, I really worry about the psychological effects that this industry can have on individuals. So with that in mind, if I can just ask, and I don't mind who answers this, but I'd like to know from your understanding, if somebody presents at a clinic today and they ask to have something done, how deep would the practitioner go in actually trying to find out where the psychological thought is of that individual, and how much they would put into trying to analyse or change? Nichola? You're not muted.
Thanks. I'm afraid to say that there is no standard across the sector, and it would be the absolute minority. I think Antonia mentioned 9 out of 10 wouldn't get any kind of psychological assessment or questioning or any expertise about what the motivation for the treatment are and what the expectations of outcome are. It is a jungle out there, and it's more Wild West than anything that's been tamed, I'm afraid. I absolutely agree with you in terms of the concern that we currently have about the damage that body image issues are having, particularly on young people, but also on adults as well. And unfortunately, this overwhelming pressure that many people experience to look a particular way and to be perfect, as you were saying, is driving them to undertake procedures with these unrealistic expectations of the outcome, and also without a kind of careful weighing up of the risks and potential benefits. So there's research to say that if someone really, really wants something and their expectation is their lives will really improve afterwards, they don't really hear any of the risk information that might be given them. So although a practitioner might say to them, there's a 1 in 20 chance that, you know, your Botox will go lumpy, they'll have a head on, if you like, they'll have a perspective on that'll say, well, that might happen to someone else, but it isn't going to happen to me because I really want this, because this is what's going to make my life better. So yeah, there is a real problem out there. There is no consistency and no regulation about how to assess people, and no expertise amongst a lot of practitioners about how it best should be done.
Antonia?
Yeah, that's great. Everything Nichola said, I totally agree with. And like I said, we collect a lot of data from the complaints that we get, and we put lots of data into different compartments. Interesting anecdotally, that after lockdown 1, and many medical aesthetic practitioners, and I'm going to highlight the word medical aesthetic practitioners, were told that they could reopen. Beauty therapists and beauty salons were still told to stay closed. I cannot tell you the amount of medical professionals that got in touch with me to say, what kind of questions can I put down on the medical assessment that will show there's a medical need for these people to have the treatments? So I said to most of them who'd contact me, so let me get this right. You're asking me to tell you what they shouldn't be saying that would qualify for them to have a medical treatment, because under a medical framework, you can do that. And they said, yes. And that's really, That's really scary and that's really alarming. And these are medical professionals who said, well, you know, and there was a big conflict, as you know, in the industry about, well, why can medics do treatments and why can non-medics do them? So I'm not going to say that it is just purely the non-medical community here who are at fault of non-screening. It is also the medical professional. I'm not going to tar the entire industry with the same brush, because there is a huge group of extremely ethical professional medical medics who do implement screening and do take that seriously, and they don't need to ask people like me what to say. But it just is very reflective of the industry that they are in. They didn't ask that question because they were genuinely concerned about the patient's or client's well-being. They were asking that question to get around a loophole, which I find extremely disturbing and quite uncomfortable. And that said as well, the therapists who were obviously quite upset that the medical practitioners were allowed to open up and work were more conscientious, were actually asking me questions that signaled a deeper level of thought and consideration for the client, because they call their customers clients, not patients. So I just want to put that to you and say that this is not about medical professionals and non-medics being better or not. That this is about what Nichola said. There is no framework there, and there should be at all levels. So that's my thank you.
Totally agree with you there. Nichola, you wanted to come back in?
Yeah, it was just a point about screening. So I think some people say that they do screen clients, and I always find that very interesting, because with the exception of body dysmorphic disorder, as David was, Professor Veale was talking about earlier, whether there is a good screening tool that can be used, all of those broader psychological vulnerabilities, there is not yet a definitive screening tool to cover all of those, because the evidence in this sector doesn't exist. So what we've been doing in the meantime, but until there can be some framework where everyone can start collecting before and after data that will help us produce that definitive screen, is that we've been using an evidence-based, the best evidence we've got, based framework of assessment. And so I completely take Antonia's point that it needs to be easy to use so that everyone will pick up and use it. But it is possible to put together what we currently know about the risk factors and to ask somewhere in the region of 10 or 12 questions. But I would go one step further and say that I really believe, picking up on Professor Chambers' points, Clare's points about the responsibility that the industry have, I would argue that everyone coming to have a cosmetic procedure should be asked those key questions, because I think everyone needs to be challenged a bit about their motivation and expectations of outcome. And sorry, I'm speaking a bit too much, but there's something that we call the beauty myths out there, which is that the kind of very firm belief that people now have that if they look a particular way, then they're more likely to be happier, socially successful, they'll have better relationships, they'll do better at work.
Nichola, does that come from the industry? Does it come from magazines and the media? Does it come from peers? Does it come from the beauty, not the beauty industry, but the fashion world or whatever, social media? Who drives that?
All of the above, which is why it's so difficult to turn it around. So social media is particularly potent at the moment, and there's more and more research to show that the more social media you use, particularly if you have a penchant for the appearance-related type sites, celebrities, influencers, the more likely you are to be unhappy with the way you look. So that's now quite clear. So it's correlational, it's not causal, but there's a strong relationship.
But are we creating like a Stepford Wives syndrome? I went out on Saturday. I went out for an afternoon tea with a friend, and the place that I went was a little bit swish, and there were more women in there who looked the same than there were those who looked original. But they, from the shoes to the dress to the hair to the lips to the eyebrows, everything, they were like Stepford Wives. They were in there. They looked perfect to me, but then they weren't. But they all looked the same. There's no individuality now. It's like everybody wants to have a stamp on their face and all look alike.
And did their faces move, Carolyn? Did
No,
they?
no,
Were they expressive?
no.
So that's a problem. So I think so cosmetic procedures that people, practitioners in that sector want to help their clients. They're after, they want to improve the well-being of their clients' lives. So but the trouble is, if they're fueling those myths, if they're going along with the idea that you have to look a particular way, or you keep having treatment, or this is the way, oh, you're going to look great after this, and oh, everyone's going to tell you how brilliant you look. All of that needs to be better understood by the people within the industry. So that training about the psychological factors and what really contributes to happiness and social success and relationship success and success
I'm
at
going
work.
to bring Judith in now.
All of that needs to be better understood.
Thank you, Carolyn. I'm very interested in this kind of questioning here, and I was particularly struck by Professor David Veale, who described it as redefining beauty, and that certainly strikes a chord with me when I've been talking to so many of our young people, and I'm turning to young people now. Who they obviously have the filters on the social media, which enhances their appearances, and this has become a norm almost. that you don't look like your photo at all. We've probably got some kind of enhancement on this Zoom call where we can all make ourselves, each other and ourselves look better. But I mean, when we're thinking of the fillers in terms of and non-cosmetic, when we're thinking of fillers and Botox and non-surgical and cosmetic treatments, do you think that there should be an age restriction on them? And should these restrictions apply right across the board, irrespective of whether you're a professional with a medical background or a professional who's a beauty practitioner, in terms of who's carrying out the treatment? If I can ask David Veale to go first of all, please.
Oh, I'm sure everybody would agree that there should be age restrictions. I mean, usually age of capacity is at 18, and I think that's probably a reasonable step to go to in terms of being able to understand the advantages and disadvantages of a particular procedure. So I'm sure 18 must be the minimum cutoff. And I think most good practitioners will do that, but there are always, it is, as everybody said, a jungle out there, and I'm sure you'll find people who are willing to do things at a younger age. Thank you. Antonia. Oh, sorry, Claire, do you want to go next?
No, Claire, do you want Claire to go ahead next?
I'm sorry, I can't see everybody in the screen. That's my problem. Antonia, you go first then.
Claire, you go ahead and I'll speak after.
Okay, thank you very much. I just wanted to say that absolutely, yes. So the Nuffield Council does strongly recommend that these invasive procedures should not be available to children under the age of 18, unless in the context of multidisciplinary healthcare. And in that light, we're particularly delighted that Laura Trott's botulinum toxin and cosmetic fillers children bill has started its passage through Parliament and has government support. We're delighted about that, and we think that's really good news. And I guess we would just mention sort of two broad sets of reasons for our view. So one is that the sort of vulnerability to body image dissatisfaction that we've all been talking about affects us all, but children and adolescents are particularly vulnerable to that anxiety and pressure concerning their appearance. They're vulnerable to peer pressure, social pressure to conform. Adolescence, of course, is a time of rapid bodily change that frequently leaves girls in particular feeling unhappy and ashamed of their appearance. So, in a way, you could say that appearance-related dissatisfaction is, as it were, normal for teenage girls. It's a period that most teenage girls go through, and so having invasive treatments at that time is, a particularly dangerous position for somebody to be in. So, marketing and providing procedures to children under 18 risks intensifying those pressures. And of course, in general, the state has a duty of care towards children and young people. These procedures, they are invasive, they are risky, they are not clinically necessary. They're not generally evidence-based therapeutic treatments. We don't have evidence they will succeed in rectifying appearance-related anxiety or dissatisfaction. They have physical effects, but they don't necessarily have effects that people want them to have in these broader areas of their lives. So I think, again, there are just serious ethical concerns about authorising invasive cosmetic procedures on young people without expectation of therapeutic gain.
And can I ask you if there'd be any exceptions to that you can think of that spring to mind, Claire?
Well, the recommendation that the council makes is that we shouldn't be having these procedures unless in the context of multidisciplinary healthcare. So there could potentially be some, you know, clinical conditions in which some of these procedures are the appropriate treatment, but that shouldn't ever be just on the say-so of either a client or of a sort of beauty-focused practitioner. It should be in the context of a team of clinical professionals. Yeah, absolutely, including psychologists and others.
And that should be compulsory.
Yes.
I can't argue with that.
I mean, you know, there's often talk about these things, isn't there, around social media circles for young people about, you know, have an injection of Botox, it'll stop excessive perspiration, and you know, there's always an excuse to have some procedure. And I'm just anxious that we don't allow our young people to be taken advantage of that way. Antonia, you wanted to speak as well, please.
Yeah, I've got a really interesting survey that we conducted, and this was a while back. It's about 1.5 years ago, because we were doing some work around the under 18s, 21 age limits for having treatments. So we surveyed 230 under 18-year-olds, but no younger than 14. But if they lied about their age, we won't know. 230 females. 170 of them said that they would lie to get a treatment that their parents wouldn't allow them in cosmetic interventions or some kind of body facial treatment. That was 170 of them said yes, they would lie. 68% of those girls also said they had already lied to access the treatment that otherwise wouldn't be readily made available to them, such as, and it went across the broad spectrum, everything from waxing to eyebrow tinting. It just really kind of went across the whole spectrum. And the third interesting point was that 228, that was almost all of the girls, said that there was no education at school about self-esteem or body image, and that 228 girls agreed that there should be more education at school. So that's a really high proportion of girls that are not being educated to feel better about the way they look, and about the influences of social media, and about body positive image and self-esteem. That's a really high amount. And if we go back down then, back to the survey, if 68% of those girls are lying to have treatments, it's because they want to make themselves look better. And if 170 of those 230 girls are willing to lie, that's quite concerning. It's you shouldn't have to lie to go to get something done to feel better about yourself. So if we go all the way back down like a snakes and ladders game, it comes back down to education. And many girls, and I've got a 15-year-old, you've got a 16-year-old, when you talk to them about body positivity, you know, feeling good about yourself, self-esteem, weight, healthy lifestyles, very, very little is taught at school. In fact, it's a tiny percentage, probably in physical education and home economics, where the subject of healthy living or exercise is brought up. Otherwise, it is not done externally and brought into the school. I think that's a massive problem. So girls have no realistic bar to measure themselves from. They don't understand that being a size 6 is not normal. It's abnormal. Why? Because the only benchmark they measure themselves up against is social media. If education was better at school, perhaps that would filter through a little bit better to our youngsters today. But I feel that because we are not guiding them in a sensible way educationally, they're forming their own opinions and conclusions about how you should look, what you should weigh, what will make you attractive, what will make you successful. And we need to change that right back at the beginning, in my opinion, at school. And maybe that will filter through a little bit, where individuality and a healthy weight and skin with spots are quite normal things. We do not all have flawless skin. We are not a size 4 or 6, and we don't all have perfectly white bleached teeth and long eyelashes. Girls today have no realistic perception of what they should and should not look like. So that's worrying.
Yeah, it is. It's really scary. A friend of mine, actually, and this is the God's honest truth, she puts a piece of white paper in her mouth of a photograph, so that the photograph shows white, as if her teeth are white. That's the God's honest truth. And she's a dear friend of mine. And every time she does it, I think, you're insane. But it's all about how she looks. I can see that Antonis wants to speak and that Claire wants to come in. So we go to Antonis first.
Just to say, I know you were asking about exceptions, and I know a few people have talked about in other contexts.
Can you speak up a bit?
Oh, yes, sorry. So there was a question about potential exceptions to restricting cosmetic surgery non-invasive to under 18s. And I've seen that some debates have included, whether they should be allowed for in cases of scarring, facial scarring, acne, and things like that. The thing is that the research in this space is quite often the samples are very small and the effect sizes again are very small, and there are many conflicts of interest in this evidence base. So we shouldn't confuse improvement or visual improvement that a practitioner would notice between pre and post an operation with also improvement in feelings about body image, positive feelings about body image for the younger kind of clients. We don't have evidence that these procedures in under 18s lead to improved outcomes for those who are in terms of their body dysmorphic feelings. And I think the point on education is really important that Antonia made. But I think there is kind of a way of how to educate young people on these issues. I think when we talk to them about, for example, kind of, appearance doesn't matter as much, or, it's important. There's so many things to your identity. I think they think we are lying. Because everything else around them tells them that appearance is hugely important. So education needs to be quite nuanced. For example, in the unhealthy foods industry, what worked was not to explain and describe what's healthy and what's not healthy. What worked for adolescents was to explain that the unhealthy foods industry is trying to manipulate them into buying their products. And adolescents, what's the one thing that they want above everything else? Independence from adult control. So there are ways, quite nuanced ways, to educate young people and give them, the evidence in very honest and transparent ways.
Lovely. Claire, and then Nichola.
Thank you. I just wanted to pick up on the education point and just say it's worth noting that there have been curriculum changes since September of this year, which now include body image as a topic on the curriculum for secondary schools. And that's a really good move forward. Of course, what's really important is that the delivery of that curriculum is evidence-based, and that teachers have the training and resources they need to deliver that appropriately. So we really welcome that. But I would just say that it would be really good if teaching on body image happened earlier than at secondary school level, because there's evidence that body image anxiety is affecting children much younger than secondary school age. So we would really like to see that education on body image and what's normal and all those sorts of issues we've been talking about happening at the primary school level as well.
I agree. Claire, Nichola?
Just a couple of quick points. So picking up on Claire's point about interventions and syllabus at school, there is a group working really hard on evidence-based interventions in secondary and now primary schools as well. So that work is happening, but any influence that this group can give on moving that along and getting the curriculum changed quickly and these interventions put in place would be extremely welcome. I just wanted very quickly to also add, Judith, to the debate about underage kids. And sometimes people say, well, let's do it on parental consent. But actually, I would really put up a big caution against parental consent for under 18s as well, because the parents are often susceptible to the same kind of pressures. They use social media, they buy into the beauty myth. And I think that's also sort of plays to the need for really good training for practitioners in the cosmetic procedures sector, because a lot of them have recently been at school, a lot of them have recently been young people, they've come out with of that system along with the same pressures as everyone else, and they genuinely believe that what they're offering to their clients is a way of improving their clients' lives, and don't actually understand the psychology of it in a way that many of their clients don't either.
It's like a pageant queen syndrome, isn't it? We see these kids who end up going in pageants and their parents pay enormous amounts of money for the flippers for their teeth to look perfect, and leave kids be kids, leave them grow up and develop at their own speed. It's absolutely scary. Go on, Nichola.
I was going to say, in the surgical sector, you'll get parents coming along with daughters who want a breast augmentation before they're 18, so they haven't even physically developed, because they believe that their daughter's chances will be better if she's got a bigger bust. So that, I think there's danger of, kind of. What
are we creating? Isn't it? Scary what we're creating. There was loads of questions that we were going to ask you, but you've been so brilliant and proficient that you've given us more than we could have ever hoped for. Judith, have you got anything else you wanted to ask?
No, that's really interesting.
Yeah.
I'm just thinking, can I just, it's a comment really on parental consent. I just remember, I'm struck that I remember being a little girl and my brother wanting a motorbike, and my grandma saying, when you're old enough, I will buy you a motorbike. Of course, she never bought him a motorbike, because by the time he was old enough, to be able to actually use his mind and his own mind, he didn't want one. And so for generations after generations, kind of the law stepped in and provided parents with an excuse not to indulge their children. So
exactly. I got grounded for having my ears pierced.
Quite right,
so
quite right.
The world has moved on, isn't it? I mean, my ears, I never forget coming home and my father went absolutely ballistic, because I had my ears, holes bored in my ears, I had, not my ears pierced, bored in my ears. Anyway, the world has moved. David, you wanted to say something?
Can I just bring us back to the conversation we're having about how to get implementation in especially the clinics and so on, because there's a lot of good stuff that's been said today in terms of prevention and so on, but we have to, I think, particularly focus on the clinics and the practitioners. And my view is that I think if any pressure can come from this report on the CQC, Care Quality Commission, I think that would be really helpful, because they do have teeth, and they can close a clinic down, and they can make demands as to what you should be doing in your particular clinic. And it tends to generally focus on the medical and the physical safety, and that's important. But I'm saying that I think it's time to move them on in terms of focusing on the psychological, emotional safety of their clients.
Well, I think that's more important personally.
So what better safeguards could we put in then for those, particularly vulnerable patients?
Well, although I've fully support Nichola as well, I've been helping her in her endeavours, that we do need better research, but there is a good enough information there in terms of what we can do in terms of screening and trying to help such clinics and practitioners to actually what to look out for and when to refer on and things.
It's got to be police though, David, hasn't it?
It's got to be police, but they must have some procedure, some mechanism in place for such screening, both either by interview or by questionnaires. And, as people say that, yes, people can get around this by lying and all these sorts of things, but it's the first step.
But I mean, these steps must be put in as a condition of licence, really, in order to stop anybody being able to practice without this work being done as a precursor to any treatment. I agree entirely. Nichola, what would we have done without you today?
We have the curriculum for training for practitioners. We have a prototype training. We have a prototype assessment. We have all of these things based on. I
tell you what, because if we could see that.
Oh, absolutely. But there are no teeth. No one has any teeth to make sure that these are put in place, and that the evidence-based versions are put in place. There's quite a lot of quackery around that we need to be careful.
But this is what this group is hoping to do. We're hoping to produce a report that will influence government. We have one of the members is the former minister with responsibility for this, but we can galvanise a lot of support to make sure that we do influence policy and we do get policy introduced as a matter of urgency, in my opinion. And I know Judith agrees with me. Well, what I didn't say at the top of this was that we are recording this. Copies will be available and the minutes will appear on the website. I always forget to do the housekeeping. Can I just thank everybody for their time this afternoon? It's lovely to see you all. I've learned so much this afternoon, and I know Judith feels the same. It's probably one of the most interesting sessions we've had, because this is where my interest really lies in all this, is it's the psychological effects of these treatments. So thank you all for your time, and catch you again sometime. Bye all.
Thank you very much.
Thank you.
Thanks.
Bye.